health and medical information you can use. This is CN8 On Call.
The holiday parties and feasts have come and gone, and summer is just around the corner. It's time to take off those heavy, bulky turtleneck sweaters and fluffy down jackets and put on the dreaded shorts and t-shirts, and worst of all, for some, bathing suits. Hi, I'm Dr. Donna Willis, and for the next hour, we will delve into the world of plastic and reconstructive surgery, specifically liposuction. We'll talk about the pros and the cons of this procedure, its history and success rate. We'll talk about the possible side effects and whether pain or discomfort is involved. And most importantly, we'll explain the different procedures and how to go about finding a doctor who performs this type of surgery. Joining me is plastic surgeon Dr. Robert Zubowski from the Center for Plastic and Reconstructive Surgery in Paramus, New Jersey. Dr. Zubowski, it's so nice to have you.
Thank you.
And, you know, we were chatting before the show about liposuction. It's one of the most, or it is the most common plastic or cosmetic surgery done in the United States.
Sure, it is.
It is that. In fact, some of the statistics that I have, it has increased 264% as far as the rate of this procedure being done between 1992 and 98, and 170,000 done per year. And it's no surprise because obesity is an epidemic in this country. 1 out of 4 Americans are overweight. But this particular procedure, liposuction, is not a treatment just for weight loss, is it?
No, it's not. And that's a misconception among many people that it treats obesity, and it really doesn't. It treats most aptly localized fat deposits in areas of the body to appropriately contour those and give a better appearance.
Now, let's talk a little bit about this. This is a body contouring surgery, plastic reconstructive surgery. Who are the patients that usually come to you?
Well, patients who certainly want to improve the way they look, who have areas of fat that are recalcitrant or very difficult to remove by exercise and by diet, that have been deposited genetically to a large degree, and that they can't get rid of by any other means.
Now, you raise a really good point, because obesity and body shape and body type is really predominantly genetically sort of, you're selected, your body is sort of selected before you come.
That's right.
And the environmental factors add to it, but 40 to 70% of how fat is metabolized in your body and where it searches and finds its home is really what happens in your forefathers.
Right. There's certainly a genetic component and there's a gender component. We deposit fat differently, men do versus women. And you know, I want to be clear also that we're really not talking about obesity, because liposuction is not a treatment for obesity. It's a treatment for these localized fat deposits that are unsightly and that are difficult to remove by any other means.
Well, let's talk about these differences between men and women, because men as well as women come to get this procedure. As far as women are concerned, because of estrogen, and estrogen sort of puts the fat around the hips and the abdominal area, and plus there's pregnancy. What about men? Where does the fat seem to go?
Well, central truncal obesity around the abdomen, the love handle areas, are more typically where we see male fat deposits. The other area that is a very common area that we will address is what's called gynecomastia, or breasts in men. Fat in the breast area is a very common thing in men, and that is a very common complaint among men that we perform liposuction on. As opposed to women who, as you mentioned, have most of their fat deposits in the saddlebag area, in the thigh area, and the buttock area.
Now, you raised another point with regard to gynecomastia, which is breast enlargement and in the chest area. And men come in primarily because they want that nice, handsome chest, and they want those love handles less. They want less love in that area. But it's not just that in particular. People come for fat in the chin.
Right.
Describe some of the other areas.
Well, you know, really from head to toe, we'll see patients who have complaints with jowling, with excess fat. That turkey gobbler in the neck, they want you know, improved. The arms, the heaviness in the undersurface of the arms here. Anywhere in the back, the chest, the abdomen, all the way down to the ankles.
Now, we talk about the fact that people would come here. This is not a treatment for obesity. It is a treatment for people who have hard-to-reach spots based on diet and exercise. those are kind of like the indications. What are the contraindications? Who are the patients that you would not want to do this type of procedure on?
Yeah. Well, we just mentioned the obese, and that's certainly, you know, one patient that we would not want to do this on. The second is a patient who may have unrealistic expectations, who may be very thin and complains about an area which is really not terribly obvious, or a patient who may have significant medical problems that would put them at a high risk for any type of surgery, including liposuction.
Now, when you're talking about the people who have medical indications, let's be really specific about those medical conditions, because you know, we talk about that it's not a treatment for obesity, but if you have certain medical problems, what makes you as a surgeon say, I don't think so?
Yeah, well, specifically bleeding problems, patients who have blood disorders, patients who have a history of blood clots, for example, venous thrombosis or pulmonary emboli. Those patients are not good candidates. There are patients who have medical problems such as high blood pressure and so on and so forth who, if they're treated properly, are good candidates. The most important, I think, contraindication, though, and the most common contraindication is those patients who have poor skin quality. The skin quality is really the most important indication for whether or not we can treat this a particular area. If the skin is not elastic, if the skin has been damaged by pregnancy or by significant weight gain and loss, we are relying on that skin to redrape properly after the suction. And if it can't redrape, then we're not going to be able to.
I really like the way you said that, redrape. And when we're talking about this sort of skin texture, here, I'm just pulling up my skin like this.
Right.
And it goes right back down. There is this elasticity. Is that what you're sort of checking for with regard to skin ability, the skin texture, the skin tone?
Well, that's one important factor. You know, the skin, first of all, looking at the skin, if we see skin that has a lot of stretch marks, for example, the stretch marks are there because the elastic fibers in the skin have been damaged. That right there tells you that the skin is not going to redrape as well as skin that doesn't have those stretch marks.
Okay. Well, we're going to talk about that and a lot more as far as the type of surgery, because there are different sort of methods that can be used. And when we come back with Dr. Zubowski, we'll take your phone calls about liposuction. Please stay with us.